All right. Hello, everyone, and welcome to School of Speech, presented by Speech Therapy PD, the podcast designed for all of us school based SLPs to come together so we can think deeply, learn boldly, and shine a light on the incredible work that is happening in our schools every single day. So, whether you are tuning in from your car, your office, or finally cozied up at home in your soft clothes, this is your space to learn, laugh, and lead with purpose. I'm your host, Carolyn Dolby, and today's topic is one I know many of you are already nodding about: vocal fatigue, or as many of us say, my voice is just done. I am so thrilled to welcome Dr. Zeth Collom, a licensed and certified speech language pathologist and assistant professor at West Texas A&M University with us today. He brings a beautiful blend of research vigor and clinical practicality. He has worked across the lifespan and is widely known for his work in voice rehabilitation, professional issues, and person-centered care. Today, he is joining us to talk about the tired voice, specifically educators' lived experiences with vocal fatigue, and his doctoral research on vocal fatigue, including a validation of the validation of a teacher-specific assessment tool. Can't wait to get into that today, y'all. But don't forget that each and every episode of School of Speech is offered for 0.1 Ask the CEUs, and that's through your Speech Therapy PD account. Let's see. Okay, here we go. Disclosures. Dr. Collom, I think I already said, is employed by West Texas A&M University and also BSA Healthcare System. He is also the first author of the Vocal Fatigue Index for Teachers. It's pending publication, y'all, but be ready when it comes out, and we're going to be talking about that today. For me, I'm a salaried employee at Portland Public Schools here in Portland, Oregon. I am also the co-founder of a new business I'm going into. It's called a Place to Start Therapy. I'm going to give you more information as it comes to fruition. And I also receive compensation from speech therapy for hosting School of Speech. All right, let's get on with this show and welcome our guest. Zeth, welcome to School of Speech.
Howdy, how are y'all? The pleasure is absolutely all mine. That was a very humbling introduction. I don't know that I'm really an expert at any of that, but there are days where I'm kind of like, I help people talk, sing, and eat good. And that's really all I say to myself. But those are very kind words indeed. So thank you. It's a pleasure.
Oh my gosh, I love it. Yes. So my specialty is actually dysphagia. Just swallowing all day long. And I always say I save the world one swallow at a time.
Hey.
But we were talking earlier, and I'm so excited to have you on. And we were kind of talking about your origin story. And I really think it is fascinating. Could we start there? Could you tell, who is Zeth? Who are you? How did you get here? Get us going.
Well, besides having a name like Zeth, it's just been, my parents loved Seth and Zach and went with Zeth. So that's really kind of the thing. But, in terms of like becoming a speech language pathologist, I said that I ended up where I was supposed to be. I just went about it in a really long, interesting way. So my mom is hard of hearing, deaf, hard of hearing, but she was postlingually had hearing loss. She has otosclerosis. She had it and has had it most of my life. And unlike a lot of people, she actually did not get amplification and hearing aids till I was about 14, 15 years old. So we actually grew up with closed captioning on the TV, kind of had to learn to be loud without shouting, talking about phonotraumatic behavior and that sort of thing. So it ended up working out really well because I ended up being a theater kid and could naturally project my voice without shouting because I had to, as well as my youngest sister, who is also a PhD. Her PhD is in chemistry, environmental science, but she went to speech therapy for articulation disorders. And so when I was, in that stage of life of I wanted to be everything from an actor to also a doctor, or, a doctor who then moonlights as an actor or vice versa, how am I going to pay the bills? It was actually my dad who brought up, I think you'd really be a great speech therapist. You should look into it. You like science but you like creative things and you're really good with languages. Think about that. Well, as I was applying for school, being first generation, the program or the school that I ended up getting the most scholarship money for did not have a speech and hearing program. And so kind of thought, well, I'm going to put it aside and let's see what happens. And I don't regret that decision at all. It gave me a very solid, broad education. My undergrad degree is actually in English literature and theater arts. And that's how I met my wife. I was a freshman in the chorus and she was the leading lady in the musical. And I thought she would have nothing to do with me for a whole other different podcast or different time. She wanted a lot to do with me. And so almost 13 years of marriage later, being together for it's 2010 and a little boy, she wanted a lot to do with me, turns out. And so I started volunteering when I graduated, and I was teaching English actually. And I started volunteering in San Angelo, Texas at a place called the West Texas Rehab, where they have all disciplines, audiology, speech therapy, PT, and OT. And again, I knew what speech therapists did, and I knew that they did more than, you get the stereotypical, well, you help persons who, can't say their R's and stutter. But in that time that I volunteered, I really got to see the gamut of, you had everything from a baby who had just been discharged from the NICU, going home, learning how to eat and take to a bottle, to, here's this 82-year-old with Parkinson's that really just want to be heard and stay in their choir for as long as possible. And it just was one of those moments of like, he'll appreciate me saying this, I hope, but dang it, daddy was right. Therapist. So I did everything you're not supposed to do, which was get engaged, move to a leveling program, try to be a supportive fiance and say like, sure, dear, that sounds great. Yeah. Wild blood. Didn't know where I was going to get accepted to grad school, then get accepted to grad school as a newlywed, and finished my master's in speech language pathology. And I've got to give a shout out to the former chair of the West Texas A&M University program, Dr. Brenda Cross, as well as one of my now faculty members, Val Parker, in that I was going to work in the schools and I became a medical SLP. And so even then, it's funny how your journey of what you think you're going to do. And then I had the great opportunity to follow in the steps of my voice and dysphagia mentor, Ann Wallace, to take over the voice side of that teaching in the program. So all that to say, I went about becoming a speech therapist in a very interesting way, but I found out a lot of voice specialized speech language pathologists actually do that. They go into music or theater or something else and then come to be. So anyway, that's...
I love it. I love it. I know that the listeners, we'd love to know how we get here, because we, SLPs, we are a different sort of animal, and yet we come from all different walks of life, and it's amazing what brings us here, and I love it. But I'm going to do another shout out to Shanae, saying, yes, we are tired. It is Wind Down Wednesday. We're exhausted. And I think this is a perfect episode for the last week before winter break, because I'm sorry, us school-based SLPs, we are winding down for the winter, and we are tired. We're tired. Our mind, our bodies, and our voice. We're exhausted. So I think going into vocal fatigue is really hitting the nerve for us right now. And so I guess what is the difference? Just tell me. Zeth, paint me a word picture. I love that. Paint me a word picture of what is vocal fatigue.
Yeah, what is vocal fatigue? I wrote a 100+ page to quasi answer that question ultimately. And it's almost, I really do think in the next couple of years, we probably will have some sort of book or series or something over what is vocal fatigue, because you almost have to take a history lesson. Vocal fatigue, clinically, it's the tired voice. And, it's almost like in its simplicity, it's actually quite complex in a way. And so, really where we start hearing and thinking of what vocal fatigue is, even back when ENTs were emerging as a specialty in medicine, this idea of laryngeal myasthenia, of the larynx literally just getting so tired that we kind of can perceive this decline just in vocal communication or vocal quality. And you see this kind of throughout the literature. And even in the 80s, we have what we call Bogart-Bacall syndrome as a reference to those golden age actors that were very powerful and known, but, they kind of talked like this with a little voice and that sort of thing. And this idea of just vocal attrition, of your voice getting weaker and not supported. But really, from a scientific standpoint, we've always kind of debated, and it's who you ask on what is vocal fatigue, and it's how you define it. So traditionally, and probably the most, we've always defined vocal fatigue as a symptom, meaning it can come, the only way for us to know that it exists, that it comes from the patient and it comes from the person experiencing it. It's one of those things of, no matter how much we want to observe and we as the clinician want it to be a sign, there is no sign really that's valid and reliable for vocal fatigue. And you have Dr. Vertolini Abbott kind of described it as this feeling of vocal tiredness. And even then, that's very touchy feely, a feeling of tiredness. But one of my mentors, Chaya Nanjar Gutapalli, who is the author of the original Vocal Fatigue Index, kind of went more into this direction of vocal fatigue can be a symptom set. So even though it is a symptom, there may be all of these other symptoms that come along with vocal fatigue that some people have and some people don't. It's very case specific. And then another kind of approach you see emerge in the literature is that it is a physiological reaction or response of the vocal subsystem somewhere. We're talking respiration, phonation, resonance. Somewhere, somehow, there's got to be an adaptation of, it's almost like working out. The more you work out, you should feel this like tiredness that your body eventually has to adapt to. And then a third approach is really this convergent approach of, it's both symptomatic, but we know there has to be this biomechanical underlying component that results in these sensations that maybe we as clinicians can't perceive when we have a patient, but the patient is telling us something about. And what was one of the positive things that came out of 2020 is that a lot of the experts in vocal fatigue, we're talking individuals like Dr. Eric Hunter, again, Dr. Nandra Deshwara-Gutapalli, Bergen, Mary Sandage, they reviewed all of this literature in our field because sometimes people confuse vocal effort and vocal fatigue to be synonymous, as well as this idea of, oh, your vocal load, as if you could put weight on your vocal folds. And really, they went through and came up with these consensus definitions that really are going to help us be able to pinpoint and study and treat vocal fatigue a lot better. And so, kind of to paraphrase their beautiful definition, and they do distinguish vocal effort and vocal fatigue, and they encourage us to not use vocal load anymore and rather vocal demand and vocal demand response. But essentially, vocal fatigue is this perceived measurable symptom that influences our vocal performance, and it is highly individual specific. And there are these, in and of itself, multiple facets that come to play that may be purely self-perceived or, in fact, physiological deficits that are the result of those high vocal demands. So, again, it's complicated, but the simple thing, it's a tired voice that may or may not. What's difficult about treating and assessing vocal fatigue is that a lot of times patients with vocal fatigue are not dysphonic. And, I teach our voice and upper airway course, and one of the first things I emphasize to my students is dysphonia, or the medical diagnosis of hoarseness, and a voice disorder. They are not synonymous. And ASHA gives us very specific guidelines of dysphonia may be part of a voice disorder, but a voice disorder can also be present when your voice does not meet daily demand, not functioning, whether or not you as the clinician perceive a change in that voice. And so, especially say your more general medical speech language pathologist may get a referral for a teacher or a performer that's like, my voice is just exhausted, but they're not dysphonic. They may say, well, there's nothing wrong with you. And that's not true. That's really relying solely on that impairment focused aspect of assessment and practice, which is still important, but it's also important to remember, very rarely do we have patients who are really making these problems up. And even if they are making them up, that's a whole different type of problem, right? So kind of moving beyond the immediate observable to more of the person-centered care aspect of what we do as speech language pathologists.
I like how you said that it would be the symptom of when your voice is not able to meet your daily demand.
Mm.
That maybe, but I think I don't know. I'm wondering, is there a difference between is there like being vocal fatigue versus, and not dysphonia? I can see how that would be a more pathological
Mhm.
thing, but like vocal fatigue is that something that we just all are susceptible to? This isn't like so.
I love you bringing that up because, again, our understanding of vocal fatigue has also been influenced a lot in the past. I'm going to say 10 to 20 years over exercise physiology. So, again, not something you automatically think of speech therapy stuff. Actually,
Mhm.
probably more PT, even athletic training. But coming back to fatigue, and this is even what you find in, say, like chronic fatigue syndrome and that sort of thing, is that fatigue can exist in basically two forms. There is state level fatigue and trait level fatigue. We all experience some degree of fatigue. I mean, let's put vocal fatigue to the side and just talk about being tired. Like, we all get tired. Ideally, with rest, we should get better and we should be able to perform this cycle of our activities again. We get tired, we rest and go again. That is normal. Everybody, to some extent, especially professional voice users like teachers, performers, speech language pathologists, are going to experience a temporary bit of state level vocal fatigue. But this is where vocal fatigue is not only a symptom, it can also be a syndrome. Trait level fatigue is where the fatigue doesn't go away. And I use the analogy of, also, think of hunger. Hunger is a state. Now, my wife would tell you I'm perpetually hungry, so put me aside. You get hungry, you eat something, hunger should go away, whatever. But your traits, I am short and I have blue eyes. Those are not going to change. They are traits of mine. They are constant. When things like fatigue get to a trait like, they are chronic. And what should kind of alleviate the problem or help reset the cycle doesn't necessarily work. And so, again, for, some people, they're going to expect or experience some level of state vocal fatigue, rest, and it gets better. But then for a lot of your professional voice users, they almost have to retrain to get past this chronic state of perpetual fatigue that does not really get better. And even in some of my research, teachers were very clear on, it doesn't matter how much I rest, my voice is perpetually tired and I don't know what to do about it because just phone it in, you know?
Oh.
So I'm glad you brought that up, that yes, to some extent, we all, if you are what we consider a professional voice user, you're going to experience some vocal fatigue, but you should get over it. But then we've realized that most teachers with a voice problem, whether it's a symptom of a greater, say nodules, even muscle tension dysphonia, their vocal fatigue is more of that trait chronic aspect than the state temporary aspect. Does that make sense?
It does, because I do know that I do suffer from state vocal fatigue, and I don't know, but it's not, there isn't a pattern to it, but I can tell that when I'm globally super tired, that it comes out in my voice too,
Yes, ma'am.
right? But then I rest, and then I'm delightful Carolyn again.
Hey,
But so I have state, but I do know I'm I don't know if I brought my daughter up before on the podcast, but my daughter, her name is True. Shout out True Hernandez. She's also musical theater. And she is a head choir director. And so voice is her instrument. And she definitely has trait and has actually gone to an SLP for support. And I know I'm jumping ahead because I know we're going to get into some of this stuff. And we do have one of our listeners, Sine. Thank you for jumping in about treatment. So I just want you to know you've been seen and heard. And yes, I'll jump back to your question after we kind of talk about maybe some of your research and stuff. But before we start with getting into your doctoral research, are there some like early warning signs that we can like be aware of?
Well, what we're finding out more and more, and there's some great research and and very clinically relevant research coming out with, you brought up that you notice for yourself that when your whole body tired, it comes out in your voice. Are finding out that, again, one of my great friends and mentors that was the co-chair of my dissertation, Chaya, is researching, the more physically well we are, the more vocally well we're going to be. That's, again, I am not, they're important, but I am not a laryngeal function, acoustics, aerodynamic person as a clinician. I think that they're important, but they're one piece of the puzzle. Obviously, I'm a little bit more biased towards what I hear and what my patient tells me. So things like the KV and patient reported outcome measures are more of my jam, and of course, strobe. But we are finding out that, again, aerodynamic and overall cardiovascular health can be correlated with being able to have better vocal efficiency and not be easily vocal fatigued. So I would probably say good rest for your whole body is what is number one. And that's so easier said than done. And anybody who teaches or is in a service profession by nature, we're the givers, we're the fixers. We'll put other people's needs before our own, but really rest and taking care of yourself is really finding out to be truly a good recommendation. There's some more research coming out of with like Liz Grillo and her work with teaching student teachers actually before they go into classrooms on how to use their voice in certain ways, and even using different types of voices, modifying that a still voice program of this is, a certain type of teacher voice versus this teacher voice thing. Really teaching ourselves on how to use our voice more efficiently is really the main thing. In terms of warning signs, I'll never forget this. Our former at West Texas A&M University, our former director of the School of Music, once said that talking and singing is for lazy people. It should not be. And what he meant, and he further explained that, but again, it's one of those things that catches you off guard. And oh, like what?
Word?
The idea is for efficiency. If you're having to push or you're having to strain or you can feel this tension, that means that something's going on, whether it's muscle fatigue, whether it's kind of that psychosocial tension that, again, kind of expresses itself through the body. We're finding more and more that we've got to pay attention to what else is going on in our body, that's going to affect our speech, our voice, and our communication. And so I hate to say that, you got to take a big chill pill, but as soon as you realize I'm really having to force this voice out, I'm having to take more air in. I tell patients all the time, and again, I'm in Texas, so I tell them, this is the time where I want you to be a Ford Focus and get really good gas mileage, not an F-50. Yeah. And those are kind of the warning signs of how much am I having to inhale this air. Now, again, breathing is free. And I even tell patients, like, don't worry about that, but just be cognizant of it. But if you're having to force it and you're having to put forth all of this physical effort, maybe not necessarily mental effort, but physical effort, there could be some signs of we've got to recalibrate somehow and be able to use this voice without just being perpetually vocally tired.
This might be a tangent, but I was just thinking about how my voice changes when I'm stressed or nervous.
Yes.
And I can't, I guess I could control it if I polyvagaled.
Right.
Like I'm just, wow, but I think I'll just speak for everyone. I'm pretty sure we've all been in a situation where our voice fails us.
Absolutely. Completely. Well, and Jackie Gartner-Schmidt and Leah Halou and lots of people have looked at this idea of emotion in voice. I mean, because literally the main component, the larynx, is wired to your emotional center of your brain. I mean, this is why your mama can always tell when you're like, oh, I'm fine. Like,
yeah,
you're either digging for her to ask more, or even if you're really trying to like, just leave me alone, like, obviously you're not. There is something that we perceive. Our voice is so important for communication. It goes back to that whole thing. It's not what is said, it's how it's said. There's a difference between, again, I have 3 sisters. So there's a difference between, oh my gosh, I love your shoes, and oh my gosh, I love your shoes. I mean, it's important. Like, again, being very mindful of your physical and emotional state. Your voice tells on you. And to your point, if you're not careful, your voice will fail you as well.
Yeah. Well, I have so many questions about like what should we do better, but before we get into like what we should do,
Okay.
let's go to like, I want to get into your research because I want to know, because what I love about your research, and really centers on teachers' voices, literally and figuratively. Like that's the whole focus, right? And because I, I think many of us just, because I talk for a living, of course my voice is tired and is that really fair for us to, to just like live with it?
Mhm. And you just hit a major, I mean, that we found out that, again, it's just not fair. And I do want to, you were talking about shout outs. I kind of want to give a shout out and somewhat dedication to, I don't care if it's speech pathology. I don't care if it's teaching. I don't care if it's medical, lawyer, electrician like my dad, good cook like my mom. Nobody can do what they do without the care of a teacher. And I really do like to emphasize that, sometimes teachers do not get the recognition nor the appreciation that they deserve. I even tell, at our program, our students, they are the body and the heart of our program. There's no doubt about that. But the faculty really are the mind and the soul. And to make a program or make anything work, you have to have both heart, body, mind, and soul. And so I do want to give a shout out to whether you teach in college, whether you teach in that daycare, whether you teach in the public schools, whether you're a parent, and you're a child's first teacher or whatever. At the end of the day, teachers are none of us could do what we do without the care of a teacher. And so with that being said, you did bring up something that a lot of teachers mention, and it's kind of harsh, and it's almost hard and very heartbreaking. And I am going to bring up some quotes from teachers that we interviewed at some point. So in terms of talking about my research, do you want me to kind of go linearly? Do you want me to talk about big picture? Because ultimately what my research ended with was a patient reported outcome measure specifically for teachers with trait level vocal fatigue. So tell me kind of where you would like for me to go and start and go from there.
Yeah, I think like telling us about, like, walk us through the process of validating, like, patient reported, how we can validate when because SLPs, we're on the campuses and teachers are going to come to us, and or we could come and to them, hey, and walk us through your research and how it came to be with the VFI Teach.
Okay.
And how, and maybe how we can use it. And that I think is what we want to hear. And then we probably want to know what we can do to help our teachers. So, Brian?
Yes, ma'am. Okay, so I'll kind of start with, short version of what a patient reported outcome measure is it is a subjective measure, but subjective is not synonymous with valid and reliable. In fact, and again, I'm going to kind of make it a little bit more school specific. I know a lot of times in school-based speech language pathology, and I definitely did this myself, but we love norm reference data, right?
Yes.
We love those quote unquote objective tests. But the reality is that sometimes our most objective measures are not the most valid and reliable for the problem that we're assessing. All right. And so again, in my teaching, especially, I really emphasize to students that just because it's not a standardized test doesn't mean that it's not as valid and reliable as that norm referenced test, right? So patient reported outcome measures really have kind of become a hot thing in rehabilitation as a whole, because we thankfully are moving towards more of a person-centered model of, at the end of the day, it is not about what the expert said. It's about, is the patient or the person or our client, however, whatever word you choose to use, are they getting better from their perception, because they are our major stakeholder, right? And so when you validate a patient reported outcome measure, you need to define a construct. You need to decide, like, why is there a problem? And really, again, I was fortunate that I got to piggyback off of Chaya's original vocal fatigue index, because it was a great tool but there were some major problems with it. First of all, it really only identified vocal fatigue as a symptom for persons with voice disorders. So it was a kind of this trait level fatigue that we know teachers have. And so what I did was my first part of my doctoral research is I did what we call cognitive interviewing, which is I basically took the VFI and I had teachers complete it. And then I said, now tell me what you think about it. Let's involve you in this process of developing. And because of that, we actually got lots of really good clinical insight. First of all, vocal fatigue is a very relevant problem for public school teachers. I did focus exclusively on certified public school teachers. And that was one of the major things that's like, oh my gosh, I perpetually struggle with my voice. These items of this questionnaire are just singing to my soul. I can't tell you how I experienced this. And the reality was another thing that we kind of saw is that teachers really told us that as they have to use their voice and as their vocal demands change, like I'll never forget this one. One of the interviewees was a elementary physical education PE teacher with about 6 sections, get this, of about 97 students in each. And so can you imagine 97 itty bitties around that you've got to keep their attention? And she was just like, the more that I've used the voice, the more I know it's terribly tired. Now, they also said that vocal fatigue is exacerbated when other aspects of their health, whether that was physical, like taking care of themselves, diet and exercise, or self-care. Or there's times here, at least in Texas, we have state level standardized testing, and teachers would say, when I am stressed, my voice is really, really not its best. And this next theme is the theme that really stuck out to me. And I think it's the thing that it's that, like, to quote like Don Quixote, it's that impossible dream that we want to fit. But all of the teachers said something to the extent of, I don't have a choice about having voice problems. It's basic occupational hazard. I know as a teacher, I am going to have a voice problem, which aligns really well with the literature that is out there about teachers and voice disorders as a whole. 50 to 80%. So 80% of teachers, and that's sometimes considered an underestimate. At some point in their career, they're going to have a full-on voice disorder. That leads to, obviously, teachers are a giving profession and a service profession, so they feel like they're not doing their best for their students. They have to take time off till they don't have it. So then do they get docked? Then they have medical. I mean, there's fascinating literature. One study, forgive me, I can't remember the reference, but we're talking millions of dollars when a teacher has a voice problem, then what subs cost, then what the cost of insurance. I mean, it's just this crazy snowball effect that you don't really think of. But it's always been, since I've started this research, it's my I just want to help this problem so much, because I don't know that teachers should have to say, I know I'm going to have a voice problem because I've chosen my profession. It just doesn't seem fair to me. Kind of on, and I also want to give a shout out to Melinda Corwin, who is a big aphasia researcher and life participation approach. Participation and being able to do what I want to do in life came up even with these teachers of basically they can sometimes do what they want. But again, if I'm so vocally tired, I don't want to have a conversation with my own kids and husband at the dinner table. I don't want to go to church or go to, drinks with buds, after. I don't want to do this but should I have to choose between my career and my social life? A balance is important. We all got a job to do. We know that. But I mean, they brought up, I cannot participate in life situations because of this. And then what was really interesting is that so many of them did what we might, as voice specialized SLPs, you might hear it called vocal hygiene strategy, like voice therapy, things like texting instead of talking after a work day, or really making sure they don't eat highly acidic foods to have reflux. It was so interesting how they were already doing these things that might be an automatic, well, here's some little recommendation, compensatory strategies that might help you in voice therapy before we do some other things. And then another thing that emerged is that as they were going through this, and doing this interview, which again, it's called cognitive interviewing. So some of this is not a surprise. It's so interesting. They said, this has made me realize how much I have to use my voice for my job and how much of a problem it is. And so there really was this almost metacognitive aha moment for some of these teachers of like, should this be normal? Is this normal? Is this, but I mean, it is that thing, dysfunction becomes people's normal, which is why speech pathologists have a job, right? And so, but these teachers, as they were filling out this questionnaire and I was talking to them about the items so we could approve it specifically for teachers, reflected and said, I don't know that I've ever been forced to think about this and then come to terms with this is a problem that is not, it shouldn't be, I shouldn't have to change how I live my life, which is a direct quote because of my voice problem. And the actual quote from this one interviewee was, I have to change how I live life because of my voice giving out after teaching. It's pretty
It's powerful, and I love how this tool is, because in my line is like, well, it's just like you said, an occupational hazard, but you're like, this is really bringing to light how this is really, if it's impacting your work, your identity, your quality of life, it's not okay.
right. For sure.
And we need to do something about it.
Exactly. Initially, it's kind of like, I also work with singers and performers every once in a while. Initially, people will probably say, well, then you just need to change jobs. You don't need, you do it right. And I'm like, well, that's easier said than done. And I was an athlete in high school and everything, but, we don't treat athletes that way. If they blow out their knee, we do serious PT and do whatever it takes to get them back on that track, on that field. And we should be doing the same to some extent, absolutely, for our teachers, I'm going to argue, as well as our performers. It's a different type of athleticism, which is why you'll hear the term professional voice user as well as vocal athlete, because teachers and singers and performers, I mean, even speech language pathologists use their voices in a more athletic type way than your average Joe. So that's kind of the first, a few other quotes that came that are really impactful. And I think that, if you're presented with a teacher who is complaining of this vocal fatigue, you just kind of know. Another interesting direct quote was, my voice has changed over the years. It's deeper from before I started teaching. So again, maybe not a perceptual change to us, but to them. And again, part of their identity is their voice. And this was a female teacher, that it's deeper than it used to be, with really no explanation other than I'm a teacher and my voice is going to give me problems. And then another one is, and I think this just solidifies what we've been talking about and what other people have talked about regarding vocal fatigue in teachers, is at the end of the day of teaching, or at the end of the day of teaching, my voice is just too tired.
I lived this. I was a kindergarten teacher before I went back and became a speech pathologist. And speech pathologists in the schools are at risk of all of this. And as a speech path, I'm tired of talking. I should have done a poll of our listeners, is saying how many of you suffer from vocal fatigue at the end of the day, because we're back-to-back sessions. Then we've got an evaluation. Then we have 3 IEPs, and then we have this. Then, I mean, it's nuts what we do during the day. I mean, so your tool is questionnaire, fabulous. But I think what else? How many questions are on it?
It is 21 items. So
Easy peasy, we can do that.
And it's on a Likert scale of 0 to 4, and it is based off the original VFI. But like I said, Chaya, what people also kind of forget about, and this is where like norm reference standardized tests and patient reported outcomes are supposed to be the same, is validation really, and assessment development and validation is really a process. You're never really supposed to be done. I think pediatric language does a beautiful job of, you have the castle, then you have the castle 2, and then you've had several versions of the self, because our demographics do change. Like right now, we have the OG patient reported outcome for voice with like the voice handicap index 30. But, if you give that, some of the items are starting to be irrelevant, because most people, especially of a certain generation, do not talk on the phone anymore. They just don't. If they talk and do a conference, they do more like Zoom or whatever. So I don't mean not really relevant, which we do have now the VHI-10, which is even more reliable and valid than the VHI-30. But essentially, Chai and I agreed there were things that needed to change about the VFI, including the fact that the vocal fatigue index, the original, is not a true index. You do not get a comprehensive composite score. So what distinguishes the vocal fatigue index from, or the vocal fatigue index for teachers or the VFI Teach from the original VFI is that we actually involved teachers in item development. That was the purpose of my pre-dissertation work. Tell us what you like about these questions. What's not relevant? What is relevant? Again, totally a teacher move. They got so hung up on a few items, like well, do you mean the front of the net, the back of the net? Like, what do you mean? So some of those had to be revised. We also had to reframe some questions a little bit because teachers do get long periods of, I'm going to put this very broadly, rest. Being married to a teacher myself, I would tell you my wife's job is never done. And she is very good about intentionally taking breaks. She's a theater arts teacher. So in the summer, she really does try to walk away from it. But there's still so much to do. But you are not required to be in a classroom for 2 to 3 months of the year. Plus, you do have winter break. And so we had to revise some of those questions to align better with being so specific. But it is 21 items across. We found out when we did our analysis of 3 factors. So vocal function, vocal rest, and then vocal symptoms and sensations. It does have good convergent validity with the VHI-10. So, and when that's really a tricky thing in assessment development, because you don't want it to be super, super similar, because then the argument is, why did you need a new tool? You want it just enough that it agrees with it, but not too much in agreement, or otherwise you are assessing the same thing and you've just spent all this time, money, energy, and for a doctoral student, sanity, of like, you're not contributing anything new really. So again, for convergent reliability, we really want to stay like 0.8 to like 0.6. We do have a true cutoff score, depending on how you crush those numbers. A score of 16 to 18 would classify a teacher as having trait level vocal fatigue. I'm not going to go into many more specifics, but it is, that we know of, it is one of the few teacher-specific, if not the teacher-specific, patient-reported outcome measure that truly identifies and discriminates vocal fatigue at the trait level for public school teachers. So I say that lightly because, publications always come out and, but at least at the time I was doing my dissertation, there was not a scale or a validated instrument that looked specifically at, we've got to identify trait level vocal fatigue in teachers that may or may not have pathology, may not have another voice disorder, but really can discriminate on that state level fatigue versus that trait level fatigue. And so I have to say, I'm very thankful for my dissertation committee, including Chaya and Tobias Kroll and Melinda Corwin and Angela Van Sickle, and of course my WT family. But it was a lot of work, but I am highly invested in it and pretty proud of it, as it consumed a good portion of my life. And my wife was really ready for it to be done too.
Well, this is exactly why I thought you have to come on to School of Speech, because we are school-based. And then this, when it is published, this will be a tool that to validate the teacher who said, my voice is tile, or ourselves, in order to discern if it's state level, trait level. I like that, giving the validation that, so, all right, so we have this tool, okay? We go through your 21 questions, and boom, shakalaka, we're at 17. What do we do? What can we as speech paths do for our teachers?
For our teachers, I mean, this also goes back into good old-fashioned, and this is where speech therapy is speech. I think so many times we think of speech as being articulation and voice being a total other thing, but really you can't have speech without voice. And when I tell students that and they think about it, they're like, wow. And I'm like, again, what speech is, right? And this is where even in our clinical practices, a good stimulability assessment is so important. This is no different than if I want to get back in shape, I've kind of got to gradually do what I need to do at the end of the day, which, for a teacher is teach, but I probably am going to have to start out with some isolated things and then incorporate more of what we want to get to. So I'm a big fan of, does the teacher even report improved sensations when they voice, when we do something like a forward focus or that something that's using a semi-occluded vocal tract. I can't remember if it's Dr. Jackie Gartner-Schmidt or someone else that talks about, and I know that Kitty Vertilady Abbott talks about this all the time, of feel first, then worry about what it sounds like. It needs to feel natural. It needs to feel good. But my number one thing when I get calls from former students or speech pathologists that are like, help me with this voice, Kate, I asked, well, did you do a stimulability assessment? Did you really see what they could do with the least amount of effort, with the least amount of cues from you to model ideal, quote unquote, vocal behavior? And they're like, and I'm like, and that was, especially for a former student, I'm like, that was part of your outline for your comprehensive exam. Truly, you've got to start with, what are they stimulable for? Don't make any presumptions on what they can and can't do. That's part of our job. Again, I would say be mindful about recommending straight out of the thing. Well, just go on vocal rest. We're finding out, and this has been emerging in the literature for probably at least the past decade, of kind of our tried and true indirect recommendations for voice disorders as all, which is like hydration and rest. They're important and they're good recommendations. But you've got to be mindful of, like, complete vocal rest, first of all, is not functional for a teacher. That makes no sense. And we're finding out now, this is also more from like phonosurgery, vocal hemorrhages, way more severe cases than saying vocal fatigue, at least from a physiological standpoint. A little bit of complete vocal rest, but then it needs to be modified. Modified vocal rest in little, what I call vocal naps in clinic, are
I like that.
just as effective as this idea of, I've got to completely preserve my voice and I can't talk unless I absolutely have to. We don't tell a runner not to run if they want to be a good runner. So it doesn't really make sense. It's not that there's not a place for vocal rest. You just have to also know that this idea of complete vocal rest may not be as helpful as the original thought when a lot of people took their voice disorders course past 10 to 20 years. Same with hydration. There's superficial hydration versus this, I always mispronounce the word because I always second guess myself, but basically whole body hydration, which is taking in fluids. Really, from a biological standpoint, all your larynx needs to do, because its main job is to protect your airway, is open and shut. That's and raise. Doesn't have to have a whole lot of hydration to do that at the end of the day. So actually, sometimes the benefit of taking in fluids, and especially like right now, all my patients are like, I'm just miserable with allergies and cold stuff. And I'm like, yes, and you're having to take a medication that's job is to dry you out even more. So, hydration is important, but it's not the end all be all. And even then, superficial hydration like a humidifier is helpful, but it's not going to fix the problem. The problem is probably something biomechanical that we've got to train for. So I am a big fan of more physiological voice therapy. So things like semi-occluded vocal tract exercises, like straw phonation, that teachers can do really, really quick, get their voice done, as well as a more comprehensive program like resonant voice therapy, or Dr. Jackie Gartner-Schmidt and Dr. Amanda Gillespie's conversation training therapy. What's really cool about conversation training therapy, or CTT, is that it is based on the principles of motor learning. So what's interesting about that is it does not follow a behavioral hierarchy. It's not about sounds, then words, then phrases. It is about conversation from the get-go, using the first basic training gesture essentially is clear speech, nice, articulate, crisp, almost what Dr. Gartner-Schmidt calls a consonant salad, almost what, your English teacher always aspired you would speak like you were given a Shakespearean monologue. Not slow, over exaggerated speech, but just nice, precise articulation and enunciation. And then embedding these sensations and these other training gestures from resonant voice, flow phonation into conversation, and using things like negative practice that you might be familiar with from like the stuttering literature of trying to control it. And if you can do it on purpose, and going back toward the new voice and the old voice, and really probably a holistic program that is going to get that teacher back to a recalibrated state to be able to do what they want to do and have minimal other than state level vocal fatigue versus trait level vocal fatigue. Is that kind of enough of a summary? We can go into more detail, and I do have a case study to kind of walk through people if you find that helpful.
Yeah. I would love, let's go into the case study.
Okay, so actually this case study is the case study that more or less inspired me to go down this route for my dissertation. So a little side note, I actually was going for my clinical or for my PhD work, I was going to study more how do we teach speech language pathologists, and then COVID happened. And we didn't know what was going to happen. Are we going to have students anyway? And then we reopened clinic, and I started having these teachers who were not dysphonic, but had a very real problem. And so this is kind of the case of Mrs. R, 52-year-old English high school teacher, referred to as by an otolaryngologist or ENT. Medical history is pretty much unremarkable. And the physician's findings when they did their medical endoscopy, no laryngeal pathology, not even really any supraglottic compression of the false vocal folds, nothing that would really even indicate like a muscle tension or otherwise functional dysphonia, right? So I'm fortunate, especially for a university our size, we do have a comprehensive voice and upper airway lab. We have one of the most comprehensive voice and upper airway labs in kind of our whole area. I mean, if you're not coming to us, you're going to Oklahoma City or Dallas,
Wow.
Albuquerque, right? So I did the whole gamut, your standard voice evaluation, patient-reported outcome measures, laryngeal function, including aerodynamic, acoustics, and strobe. Her voice was known what we would call normal phonic, meaning there was no perceptual dysphonia. I think on her KV, the data I have here is, I mean, it was a 12 out of 100, and that was really pushing it. I mean, that was almost like, what's going on? No impact on intelligibility, but she reported the following symptoms. She called her voice scratchy. She had an inability to project her voice in her classroom and a tightening sensation in her throat as the teaching day continued. And I thought that was really funny to me of the tightness isn't constant. It's as I go, it emerges and it gets worse. She would completely lose her voice on some days. Endorsed that these symptoms became more profound and consistent as the school year progressed. So you can almost hear this pattern of a progression of severity as well as presence of these symptoms. As an educator, she had experienced voice problems throughout her career, just thought, hey, it's part of the job. Again, validating some of my pre-dissertation work that we eventually found. And she did disclose that her voice problem really impacted more than her job. She had 2 teenagers of her own, and she was getting to where she could not. She is from a smaller rural area, the Texas Panhandle. Amarillo is kind of like a rural hub, if you will, but it's several smaller communities, farm agriculture based. I mean, where Friday Night Lights is like a real thing, man. But she was avoiding things for her own kid because she could not vocally muster up. Yeah. And she's even said that she could not cheer at her kid's athletic activities, nor could she converse with her husband at home after work due to what she called, and this is a direct quote, vocal exhaustion. And so, again, like I mentioned, I did your standard, and her strobe showed nothing. Sometimes ENT exams are just a steady light, while strobe can be more sensitive. Really nothing major. Her acoustic measurements even kept repeat prominence, which is kind of the new hot thing. And, a lot of us were taught shimmer and jitter and noise to harmonic. Well, can prominence take back? Her pitch was within normal limits for her age and gender. The only thing that stood out that told me there is validity to her problem was her scores on the original vocal fatigue index, because again, the VFI teach wasn't around. And she had quite high scores in the factors. Again, you have to score it by the factors, not as a whole instrument. But part 1, which is tiredness and avoidance, a 24. She had physical discomfort, and she also kind of had minimal improvement with rest. And so for her actual like voice therapy, what we did was our kind of overall goal was to maximize vocal efficiency for teaching and socializing outside of work. So we almost had two goals. You're going to get better at using your voice to do your job, but we also want you to have better life satisfaction and your voice is not in the way. And I think sometimes, especially when we're trained so much from an impairment focus, which is slowly the direction we're not going anymore and how we're training our clinicians, writing a goal of like the teacher will report improved confidence while teaching may be at first like, is that really a specific and measurable goal? It is, and it's tied to an outcome measure. And that's super important because that's what the teacher wants, right? Or the teacher or, Mrs. R will be able to have a conversation with her husband after a day of teaching without being vocally exhausted. Think about how functional, we always stressed it about goals should be functional. That is super functional and it is specific and measurable, not only in what we're doing in therapy, but also what they want and why they came to see us. So we did essentially have those two goals of you're going to be able to use your voice for your job and you're going to get back to being able to go to your kids' pep rallies, have a date with your husband. And she went to, overall, she attended a total of 8 scheduled voice therapy sessions. We did use a little bit of laryngeal manual therapy to kind of help with that tightness sensation. I'm a big fan of training exercises, which ones you like best and feel like they're doing the best for you, go for it. So things like straw phonation, vocal function exercises. And then we did eventually do conversation training therapy, a little bit modified, where she had to come up with lessons that she would practice and teach. And that was really her ultimate in session as, can you teach me an English literature lesson? Her favorite author was Edgar Allan Poe. So she taught me, which again, we also bonded. That's part of conversation training therapy, is this therapeutic alliance of building rapport. So she gave me a review over Edgar Allan Poe using these strategies, as well as kind of indirectly. I also told her, these are high school kids. Now, yeah, they're immature sometimes, but they also can read, or they're supposed to. You don't have to talk for the full hour. And even helping her realize I can teach my classroom differently so I don't have this problem, as well as, oh, I can do these exercises during my conference period. And so, again, she attended her sessions, 8 total sessions. And then at the end, I love proof is in the pudding, right? And nothing says better, but her overall BFI scores were so much better. She went from a 24 to a 6 on that factor.
Oh, wow.
Absolutely no physical discomfort reported. And again, when she started to realize I've got to rest vocally and otherwise, and sometimes vocal naps are just as good at not talking at all, she had a positive response to incorporating those vocal naps as well. And so that kind of a case study in how to address vocal fatigue in a teacher.
Thank you. I think that is so helpful because putting it into play is what we want to hear. But I also, Joni, thank you, Joni Kuda. Her PTA at her school purchased those sound field systems, those FM systems for every classroom that helped the teachers amplify. What do you think of that?
I think that's great. And, my wife, also being a teacher, when she started having some teacher vocal fatigue, that was one of my first recommendations of, now you can get on Amazon and buy yourself a relatively inexpensive, you can even buy one of those microphones that has the amp like on it. And that's what she started doing. So no, I think that that's perfect. We know that kiddos, even, this is where my oral rehab brain kind of even comes in. We know that kids do better when they have amplification and it's direct to them, not just our hearing impaired or hearing clips. So amplification helps everyone. Now, the one thing I will say for people who are not familiar with using amplification and using microphones is, don't fall into that lumbar effect or that cell talk of, there's almost this temptation of, because I've got a microphone, I'm supposed to talk louder. No. The microphone helps you talk normal. Don't shout into the microphone. You see this all the time with like Zoom calls, and which is why when we were doing our sound check, am I at a good level? Because you really tempted to use cell talk or cell yell to, because I'm on a phone call or a conference call, I've got to be louder, or because I've got a microphone, I've got to be like, no. The microphone will help you and let it do its job. So that's my one caveat when you recommend amplification for a teacher is, remember, this is to help you. You don't have to overdo it now because we've got a microphone in front of us. So no, I think that's a fantastic suggestion. It's one of my number ones, even for small classrooms. Again, some of those small, older schools, their acoustics are terrible. So it's not going to hurt to have a small amplification system as a teacher.
So, and I know that we can never give a plan of care because it's totally patient specific. I get it. But I just kind of wrote down some things and that might just be like our go-tos, like that might be universal that we could have in our toolbox. So our SLPs that are listening right now could bring back to the campuses tomorrow. Well, actually, maybe because I'm thinking I love your idea of vocal nap.
Vocal nap.
Vocal rest is not. It's not. So, one I was thinking to tell our SLPs to go back is the vocal nap. But I loved on that case study about if you are in an upper grade, have your students doing the reading versus you. Give yourself a vocal nap. What are some others that you would want our SLPs that are listening to be able? Just general good ones.
Again, when we talked about this kind of earlier, being cognizant of where we're at in the school year of, if it's state testing, if it's state testing time, you're going to be more tight. You have to make even more of an attempt to take care of yourself. This could be dangerous. So I'm going to be careful of saying, it's kind of like saying, oh dear, everything's going to be fine when they're.
No. Yeah.
Don't necessarily say you just need to relax. No. Need to be cognizant of there's more to voice than just the larynx and just talking. It is all interconnecting, our breathing, our physical health. So just being cognizant of that. Probably again, like I said, start with a good stimulability assessment. So many teachers are like, I have to talk like this and so everyone hears me. Okay, granted. But what happens when we do that clear speech? And see if they can just imitate you in some automatic speech tasks. Like, let's not do 1, 2, 3, 4, 5, where we're almost attacking that. Let's do more 1, 2, 3, 4, 5. Using that clear speech, that more legato sound, that is more vocally efficient. So clear speech all the way around, which actually, again, really comes from the hearing impaired literature and then has found its way into speech for dysarthria and voice. It just should be in the back of, because so many people, when you cue them and you model that behavior, it is so interesting to see. Like I'm working with a gentleman right now that is a different type of professional voice user, but he calls it his mansplaining voice. So it's kind of speed, monotone. And as soon as I modeled clear speech for him, total different. And he said, that feels better. And I'm like, yeah, man, like I hate to say this, it's kind of how we're supposed to talk with respect, of course, to cultural differences. And that's more of a standardized American English standpoint. And you would always consider that. But yes, it's more efficient. So clear speech, always going to be a great recommendation. I'm also just a big fan of forward focus. You got to be careful. And you may even have to explain this sometimes with teachers of it's not being hyper nasal. It's just adding a touch of forward, whether that's the nose or in the lips. But so many people think that their voice is their voice box and they want that energy. And the acoustic energy does come from the larynx. But really, voice is not just the larynx. It's the breathing. It's the larynx. It's just like a car. Gas, motor, make and model. And relying on that resonance, Kitty Bertolini and Joseph Stipple's resonant voice programs come from actually acting of, for a long time, actors weren't amplified on stage. They had to project their voice, right? And so using that resonant subsystem of a more open mouth, the vibrations are more in the face, that forward focus, utilizing a or even a z at the beginning to get that forward placement rather than a backwards placement should also be, in my opinion, a go-to. And then some very discrete exercises. You can look up Joseph Stipple's vocal function exercises. If you're not familiar with Dr. Keats's idea of the semi-occluded vocal tract exercise or SOVTEs. That has been probably now an established thing of voice therapy for probably the past more than 10 years now. And there's various semi-occluded vocal tract exercises. And some people even argue that resonant voice is a form of SOVTE. But really looking at something discrete that teachers could kind of do, kind of like your reps when you go to the gym, do this exercise to build this endurance kind of up. There's some emerging literature on respiratory muscle strength training for vocal fatigue, but again, don't really want to say like, that's one of your go-tos. But I think the basics of clear speech, forward focus, vocal naps, more emotional whole body awareness are kind of like your top 4 recommendations for where to at least get started. Of course, with a stimulability assessment for a teacher fatigue, from at least my standpoint off the cuff.
All right, I hate this, but we are seriously out of time, and I cannot believe because I don't want you to go. I want more of you. Okay, that sounded weird. I want more of your information. Sorry, that was super strange.
You're great.
But I mean, I want to just thank you for coming. I want to ask if you'll. No, thank you. Shanae is like, could we have a part 2 where we do like treatment and more of that? Could we?
Absolutely.
Okay, because this is the last episode of season 3 of School of Speech. I'm going to take a little vocal nap and through the winter break, and then we'll start back up again for season 4. And I want you back season 4. So you heard it here first, people. You heard it. He said yes. So it's happening. But I do want to just thank you so much for just your work, sharing your work, and reminding us that about vocal fatigue. And okay, listeners, if you work with teachers, you know what? You are here. You're going to be powerful positions to help them. I know we are going to have a part 2. I want to thank everyone for being here today. Really caring deeply about our voices. If you guys have enjoyed this episode, there's going to be a part 2. But I do want to make sure if you do like it, leave us a like, leave a review. I want to thank everybody for tuning in today. And I cannot wait to see everyone on the next episode of School of Speech.